All right, good morning. If you are here for the Legislative and Human Resource Committee meeting, you are in the right place. We'll have two presentations here today. The first item on the agenda, though, is public comment. If there is something that you would like to address the committee with, that would be wonderful, and you have 3 minutes.
How you doing, everybody? I'm D. Jones. I'm an international visionary. I could definitely say that. I'm an International Business Award winner. And I actually just got a nomination for another award, the Burge CEO Awards. If you don't know, that's like the Oscars of CEOs. You got royal families like the Rothschilds and the Rockefellers and the royal families from Dubai. If I happen to win this award, I'll be going on a luxury cruise and I'll be getting an award. That's from esports. Work that I did here. I know I'll be a billionaire, a powerful, powerful billionaire. I know about the global elites, all of the theories people say like that. But I know these people exist. And these are the type of people that I've been I've attract. These are the type of opportunities. So I've always been into government. I've always studied the billionaires and the people that are trillionaires and people that are worth trillions of dollars. It's even funnier because a fake Facebook page, Jacob Rothschild, followed me on Facebook. Now, I think I'll probably come across him one day if I keep working hard because I've already got an invitation and I'm already a nominee for a prestigious award. This is very prestigious. I think you guys work in government, so you guys know what I'm talking about. But I'm a young black African American, a visionary, a true visionary with a vision to transform my community, and that's the award that I happened to get. I asked for the visionary award, but they went over everything that I sent them. They said, you could be the transformational leader of the year. And so that's the award that I'm possibly going to get, so I have to fill out all of my info. I got to get all my certifications, you know, everything that I've accomplished, and hopefully it's good enough to get this award. And then also, as you guys know, I'm looking to bring the Ultimate In-Gamers League Championship, the $100,000 esports league. I'm a regional director for a video game, and now we're all going to bring the synergy together. And so the video game that we're developing is actually going to be played in this gaming league. I know I'm going to be rich if you guys can get it. So when we talk about feasibility or sustainable businesses, I'm going to be a billionaire. Do you guys hear what I'm saying? This is me, D. Jones. I know what I'm capable of. I got accepted into Harvard. I'm a very intelligent young person. I'll never let nobody run game on me. I know the game. Pass me the dice. I'll be on board. I'm not on the board of the Kent County Commission, but I'm definitely going to do great things for Kent County. I'm a leader. I'm going to be a global business leader. I got full confidence in myself. I did this 90-day grind here, Kent County. And you guys seen that every day. I came here every day like I told you guys last year. I'm going to show up every time that I can. And that's what I've done. I've been consistent, persistent, and that's who I've been since I've been here. This is who I am. I'm going to be a global business leader. I'm going to be a billionaire. Even if I don't win this year, I know I'll get another opportunity. I know I'm going to be a billionaire. I'm going to come across those royal billionaires, the Rothschilds, the Rockefellers. Thank you.
All right, thank you. Is there anyone else that would like to address the committee? All right, seeing no one, we will move on to Kaylee. We're the probate court on the other side of the microphone for us. So Kaylee, go ahead.
All right, well, hard to follow that. I'm not internationally known, but like DeAndre, I want to do great things for Kent County. So I'm Kaylee Gasho, the probate register, and I'm here to represent the probate court. I'm also here to represent the Kent County Public Guardianship Program, and we're going to take a little time to discuss what the probate court does as far as just overall and the guardianship program. And also I'm going to talk about what we hope to accomplish in the next few months. All right, so first, most of you already know, but the probate court does handle quite a bit, as I'm learning more and more every day. We handle decedent estate proceedings, trust proceedings, civil actions, guardianships of incapacitated individuals, conservatorships, protective orders, and a lot more. And then this is just a presentation overview of what I'll be discussing today and the performance dashboard. So the mission of the Kent County Probate Court is to provide an accessible and person-centered venue to secure the peaceful, sound, and efficient resolution of matters wherever every individual is treated with dignity and respect. And through education, collaboration, and systematic improvement, we try to live up to this mission every day. Our bottom line is that it's all about the people we serve. We are very customer service focused, and I think that's seen through the public, the reactions we get from the public. We receive at our counter on the second floor of the courthouse just across the street thank you notes and people coming in all the time. A couple of our second floor clerk staffs actually received homemade brisket that someone brought in because they were so appreciative of them helping them, and unfortunately it was before I started that position, so I did not get to partake in the brisket. But I mean, people drop off flowers. Our name change clerk helped someone process a name change where they were going to be attending a cruise, and their passport had a different name than their driver's license. They wanted everything to match, but it was a crunch because they left for the cruise in a couple months. And the name change clerk worked with us to make sure that it happened, and the person was so appreciative they brought flowers to the desk. Obviously, we're not soliciting these things. We don't accept cash. We don't accept gift cards. We're not asking. If someone calls and asks, we say no, please don't. But when someone brings in brisket, it's kind of hard to, hard to turn that down. So I do think that we're doing our best to serve the public, and I hope that we can continue just being empathetic to the people who come and visit us. Unfortunately, the people who do visit the probate court are kind of in their worst time. It's after someone has passed away, a family member may be incapacitated, or a child may be going through a mental health crisis. So when people visit us, they're not usually happy, they're not in their good season of life, so we try to be empathetic and kind of take that extra step to really make them feel that they're being heard and try to help them out. A lot of our forms can be a little bit confusing or foreign if you're not used to it, so we try to take that extra time to work with people at the counter and really help them fill out the forms properly, and that helps the process down the road. So our strategic goals are to timely handle and fairly adjudicate all matters before the court for the protection of individuals and their property. We strive to maximize the effectiveness of probate court staff through innovative technology. We systematically collect reimbursable legal fees and facilitate the provision of professional guardians for incapacitated persons in need. One of our strategic priorities is excellence in service delivery, and our goal is to timely handle and fairly adjudicate all matters before the court and for the protection of individuals and their property. And our objective is to meet or exceed statutory court rule and state guideline requirements for all matters before the court. And you can kind of see the little pie chart there, and that is showing all of our 2022 new filings that the court received. And you can see the majority of our filings that we deal with are mental health proceedings, either within Kent County or mental health proceedings that we do for other counties in Michigan. And so that's quite a bit of the pie chart there. And then the second largest is decedent estates and then civil actions as well. In 2022, the Kent County Probate Court had over 7,900 new filings, and we conducted over 3,500 hearings. And we've noticed an increase in new probate case filings of 15% over a 10-year period and a 45% increase since 2008. So pretty significant increase within the past 10 years. This chart is showing our active cases, and you can kind of compare 2019 through 2022. 2019 was definitely a big year for us prior to COVID, and then we're still just slowly kind of getting back up to speed now in 2022. In the last 10 years, new adult guardianship cases have increased by 47%, name changes have increased by 85%, and guardianships for developmentally disabled individuals have increased by 55%. Within the last 10 years, requests for mental health pickup orders have increased by 87%. Our significant accomplishments, of course, for 2022 have been the addition of a judgeship, Judge Avery D. Rose, who was here last year in front of you. And we've also added 3 additional positions, so 2 judicial clerk positions to support Judge Rose, and then 1 assistant supervisor position that supports our second floor clerk staff. We've also streamlined a few processes. Name change payment processes was one of them, and then also scanning documents into our on-base system. We've also had some technology improvements. Our guardianship program has purchased the AIM software through the Area Agency on Aging of Western Michigan. We got a grant from them, and that software helps our guardians track cases as well as track billing. So we've been continually looking for ways to improve technology, and that's one of the things we're going to keep working on also this year and next. We also were happy to give back to the community in 2022. The judges provided presentations at Pine Rest, the Probate Institute, Faith Hospice In-Service, Corwell Hospital, and the Grand Rapids Bar Association probate section. So for those of you who don't know, we do have a Kent County Public Guardian Program, and what our guardians do is provide guardianship and conservatorship services for adult residents of Kent County who have no one else to serve them in a fiduciary capacity. So you can see the picture of the t-shirt drawing up on your screen, and that was actually done by one of our incapacitated individuals. They won a t-shirt contest, and Holly Momber, who is one of our public guardians, submitted this to me because she was just so proud of him winning this t-shirt contest. And Holly says, "I'm so very proud of him. He's a great artist and a wonderful storyteller." So our public guardians really do care about the people that they serve. A lot of them are very engaged in their day-to-day lives, talk to them multiple times a month, and definitely support them throughout all their endeavors. In 2022, we had 225 new requests for the guardians, and we had about an average of 542 indigent cases handled by public guardians per month. We hired 9 new public guardians. We have 40 serving in the program today, and we have seen an increase in retention through our public guardians. Before, we were losing quite a bit each year. And I just wanted to say a special thank you to our funding sources, especially the board in Kent County. Looking ahead, we are working on right now scanning more of our closed files. We have quite a few rooms in the courthouse just stocked full of closed files, and it's just wasted space at this point. So we're really working this year at scanning those documents into a digital system to free up that space. And once that space is freed up, I'm hoping we can work towards some workspace improvements. We have one giant file closet right now that has beautiful windows, and it's just filled with files. So if I can get those all digitized, I'd love to move some staff there, or maybe have a sitting area for staff so they can actually look outside and enjoy some sunlight. So that's something we're working on. We're of course always trying to get e-filing figured out. We're still waiting with the State Court Administrative Office on that before we can move forward. We are also looking at technology, specifically with AI. There has been just so much developing, as you all know, with AI, and especially in the way of the court system as well. So we're just watching that and staying aware of what's kind of happening with AI technology. The probate court staff is also 100% participating in the Disney Way training, and that is all I have for you today. So if you have any questions, please let me know.
All right, thank you, Kaylee. Commissioners. Commissioner LeGrand.
Thank you, Chair. Welcome back, Kaylee. Nice to see you again.
Nice to see you.
I'm just wondering if you could explain the work that we do for other counties and how
Sure.
that unfolds, and also when you say civil actions, if you could give us some examples of what those are.
Sure. So what we do is, as you know, Kent County is a huge hub for hospitals, nursing home, mental health care. So we take in a lot of patients out of county. They may be from up north. Some of them are from right next door. And so when they're here, we hold court in lieu of them going back. I couldn't answer it fast enough. Of them going back to their home county. So they're here, we know the hospitals, we have relationships with the hospitals here. They know, hey, we have court at 2 o'clock, and that's when we hear all of our mental health cases. So it's just an easier way that we work with other counties to hear all those cases, and it makes it so much easier for the hospitals and the hospital staff to coordinate with just one court instead of all the counties in the state. So that's kind of where we're doing those cases, kind of just like as a favor of making it easier for everyone and making it a more efficient process. And then civil actions, those include more of our cases that go in front of the judges where there's disputes. So that could be, dispute over an estate. It's kind of going towards that second step of what ones really have contested hearings. I can get you more information on that later on. I'm still learning a lot as well, and I'm sure we have a lot of like weird little one-off cases that you wouldn't think of that fit in that category as well. It's our miscellaneous category.
Okay. And then when you had the slide that had all the numbers for the last few years, and I'm forgetting what the top one was, that was a drastic decrease from like 3 years ago to now. Do you have that in front of you? And I was just curious, I'm sorry, I can't remember.
Maybe, I think it's slide 8. This one?
That's the one, yeah. So estates and trusts was up at almost 8,000 and then dropped to 1,800.
Yes.
So
and
I'm just wondering if you could explain that. Do you know
You know,
anything
I
about
don't
that?
have a great explanation for that, except that it's been happening throughout the entire state. We compared our numbers to the other counties, and they've all seen the same kind of trend. And we've seen an additional, like, kind of trend with just caseload in general, and we don't know why. But I've been asking the other probate registers, and we all are kind of not sure what's going on there. So, great for pointing that out.
Okay.
And if I find out more, I can fill you in, but right now, we're all kind of just waiting and wondering.
Okay, thank you. Thank you, Chair.
Thank you, Chair. You indicated that you increased the number of indigent lawyers, is I guess that what you would call them? What are those individuals? Are they lawyers?
No. What do you,
You increased, you said by 9, guardians.
Oh,
guardians.
yes, sorry, no, they're not lawyers. I mean, a couple of them are, but they're not doing it for that purpose. To be a public guardian, you do not have to be an attorney. And so we try to keep our roster of public guardians around 40. So there are 40 contracted professionals that contract with the Kent County Guardianship Program, and they serve as guardians or conservators for the individuals who need it. So they're appointed by the court. But to be on our roster, they do apply through us. They submit a resume, we do interviews, the whole shebang. And they are constantly picking up cases as they become available. So they pick up cases for people who maybe don't have family who can serve as a guardian for them, no friends in the area, things like that. It's the people who have no one else to serve for them.
And you said you keep the number at 40. Do you anticipate the need for more in the future?
Yeah, we try to shoot for 40, but we do always accept people as we go. We don't necessarily advertise for the positions to be open because we're really looking for specific people. We get a lot of our people from referrals from social workers, hospitals, people who kind of already know and deal with incapacitated individuals, so they have that background. So we're kind of more on a referral service for maintaining and keeping new people. But we're always doing interviews. I think we're doing interviews next week, actually, for some more people.
All right. Commissioner Hennessy.
Let Kaylee go by without a question. I was actually, I'm pleased to see that there's a leveling off in the numbers for adult guardianships, in that it really is to follow up on Commissioner Bujak's questions, I mean, it really is very much a total control of how that person, where they live and how they spend their money. And so I'm really glad to see that there's a leveling off instead of the increase and the increased need for funding that we've had in recent years. My question, though, is you talked about the Disney Way training, and we're all aware that you're getting it. But tell me, how does that apply to how you're providing your service? How do
Sure.
you use it?
Yeah, we've really been trying just to think outside the box of going the next step of how we can serve people and help people at the counter. So our front counter clerk staff have all gone through it now, I believe. The last few people are finishing up still, but just going above and beyond instead of there's a big long line of people at the counter and maybe it's not your counter day. Just encouraging people, hey, there's a big line, step in, help out, even if it's not your day to serve. And I've really seen a difference. I think even before Disney Way, we had excellent staff, great staff, well-trained staff. But, just a shift in attitude, too, of just a little bit more positive, a little bit more collaboration in the office. So I'm really happy that they were all excited to it. I didn't have to force them to sign up. I said, hey, I want everyone to do this, and they were more than happy to do it. And I think we've definitely seen some positivity come from it. Of course.
All right. Kaylee, like you mentioned, what I think one of the most important things that you said in your presentation was you're taking folks that sometimes at the deepest, lowest part of their lives with a death or just things that come up in life, and yet the thanks and the flowers and the brisket and that really tells I guess the commission and our community, right, what kind of compassion and empathy you have for the community and the residents of Kent County. So again, I think that's one of the most important things that you do, and we do appreciate we appreciate that. You can let your staff know as well that they're doing a great service to the community and the residents of Kent County. We'd appreciate it.
Yeah, I will do. And a special thank you just again to the staff and to you all as well. I definitely could not do anything without the staff, and they're a huge help, and I'm learning so much from them every single day. So thank you.
Thanks, Kaylee. All right, our next item on our agenda is the Health Department. Adam. We are giving Adam a little grace here today. He wanted to do this in 2 presentations. We're like, well, let's try to consolidate it in one, so we might be a little over the 10-minute line, but I said he's got 12 minutes. So so anyways, we're going to give Adam a little extra time trying to.
And I'll do my best with that time. And of course, those questions afterwards don't ever. And good morning, and excuse my voice a little bit. I've learned over the past week or so that I have an allergy to all the roasted grass around my house. And so I'm struggling a little bit with that. But first thing I want to point out to is our brand new logo, which great appreciation to Lori Latham and the admin team for helping with the rebranding, and all of you for helping with the rebranding process. I think it's pretty sharp. And you see with our logo, it is similar, as all of the service departments are, to the county's overall logo. Each service department has a symbol that represents what they do. And our symbol is very like the national public health symbol, with the 3-sided shield, the 3 sides representing serve, protect, and promote, and including a joyful, exuberant human form on the inside of that. Someone recently pointed out that it also looks like someone reading a book, which I think is also very appropriate because we really strive to be a learning organization as well. So we're pretty proud of that new logo. I think you know the drill. I'm going to basically go over alignment, what we do, our goals, a few of our performance metrics. It's hard to get the metrics of 60-plus programs into a 10, 12-minute report, but I've picked a few. I've also included some information on a couple of priority issues that this board has communicated to the health department, lead and opioids, in this presentation, so you'll get an update on those things. And then a look ahead. Your priorities set in 2019 with your strat planning process identified these 5 things. And I think you'll see these five themes present through much of what we're doing. And we're very supportive of these 5 priorities that you have, because if this community, this organization is doing these 5 things well, we're much more likely to have a healthy and safe community. Our mission at the Health Department: serve, protect, and promote a healthy community for all. We're really proud of that mission statement. We think it's the most succinct of all of the departments. It's a challenge to all of my brother and sister departments to be more succinct in the mission statements. Really expect our staff to know this by heart and to live this in the spirit of what we do. And the Disney Way training was brought up. That's really important to us. We see an alignment there. We really think the most important 2 words of this are the first and the last: serve all. And that's what we strive to do in everything that we're offering at the Health Department. So diving right into a selection of metrics, this first one is related to treatment of people with latent tuberculosis. And a fun fact for those of you that were at the commissioner orientation, you've heard this before, but Tuberculosis, up until the year 1900, of all the humans who had ever lived, 1 out of every 7 of those humans died from tuberculosis. TB is one of the most significant killers in human history. Now, thankfully, over the last 120 plus years, we've managed to rein that in through better care, and especially with the presence of antibiotics. But it's still out there, and there still is an impact every year. And through this program, we're testing thousands of people every year for tuberculosis. We do find some. At any given point in time, there's about 150 in our program that we're providing treatment for latent tuberculosis. This is where they have the organism in their body. It's not manifesting itself with symptoms of illness, but there's that possibility that it will activate and infect a part of their body in the future. And we've seen some of those even causing infections of the eye. So it's not just the lungs with tuberculosis. Our goal is to have 90% of the people that we identify with latent tuberculosis in our therapy, a direct observed therapy program. Right now we're at 98%. So I think we're doing pretty good there treating those individuals. Wells and septics. Every year we receive about 700 or 800 requests for new well permits and about 1,000 permits requests for septic systems. We met with the industry a few years ago and worked on what their expectations were. They really want those turned around in 2 weeks. And that's how we built our staffing and our fee structure to make sure they get that. And they have to have them within 30 days. And so our goal here is to make sure that we're getting those within 30 days. Right now we are meeting that 95% goal. And usually what we find is that the remaining 5%, there are things missing on their part. We're still looking for a site plan. We're still waiting for an excavator to be present. We're still waiting for some other data in order to complete that service. This metric is related to our refugee screening and health care navigation program that we have. And these are refugees, and don't think of this as the same problem that we have on our borders. These are refugees from State Department programs where they are moving people from war-torn areas around the world. In many cases, these are people who were providing service for or allied with American interest in those places, such as in Afghanistan, in Syria, in other places where, because things have gone badly, they need to be relocated, and West Michigan is one of those places where they are relocated. Normally we get about 500 to 600 refugees in a year. You see that during the pandemic year of 2020, that was greatly reduced down to 117. Last year at this time, we had 354 people, and my guess was at the time that we were going to see an increase, a pretty significant increase the remainder of the year because of refugees from Afghanistan. We did see that. We had 605 in total during 2022. And we expect to see a busy year this year. We're seeing many refugees from the Congo right now. And of course, what's happening in Ukraine and in Southeast Europe is concerning as well. The next metric is related to our Children's Special Health Care Services program. This is a program we're really proud of. This is a program where our staff works with families who have a child with a significant health impairment. They were born with a birth defect, they were injured in a car accident, whatever the case may be. We now have a family that has this challenge that they have to learn how to provide care for their child. In many cases, it's things like how do I clean the ventilator? How do the feeding tube? How do I help to teach my child who has this impairment now how to read? All of these challenges that we want to make sure these families are put in the best position possible to care for their child and to see them as successful as a family and as a child as possible. We have seen a pretty significant increase over the past several years in participation in that program. We're now just below 4,000 individuals who are in that program. Part of the reason for the increase has been that a few more diagnoses have been included for eligibility, including autism for the program. We also see that because our infant mortality has continually gone down, great thing, that also has driven up our participation in this program, because in many cases, those who are now surviving are surviving, but have our children with significant health issues. Just a potpourri of some additional metrics and measures, and many of what we're working on right now are under construction, because we recognize coming out of the pandemic that we need to be rethinking some of the things that we're measuring and what our priorities are. We have approximately 13,000 people participating in the WIC program. 95% of those are actively participating, meaning that they're meeting their appointments, they're getting their benefits, they're using their benefits. 99% of participating children in the WIC program received fluoride dental varnish during WIC appointments. That's a new service in the past few years that we began offering that's aimed at reducing the prevalence of dental decay and dental caries in those kids. 25% of the children in the WIC program have been found to have low hemoglobin levels, that's low blood iron. That's a new measure, and this is the first time we've measured that. It's an indicator of malnutrition. So we want to target that to see that number come down significantly in the next year. So despite being in the WIC program, there's evidence that they're not getting the nutrition that they need. 78% of our children here in Kent County between the ages of 24 and 36 months are fully immunized. That's down about 4% from where things were before the pandemic. 151 more enrollees in the PrEP HIV prevention program. That's a program geared at identifying those at the most risk for acquiring HIV, working with them to make less risky choices, but also working with them to make sure that they have the protection to lower their risk of acquiring that infection. We have more schools and classrooms participating in a life skills program. That's really focused at middle school and high school kids, trying to encourage them to make better choices, especially related to substances. 85,000 children received hearing and vision screenings last year. And a portion of those in the hearing are referred on to an ear, nose, and throat specialist, and they have a true hearing deficit, but oftentimes it can be corrected simply by the screening and then by having an ear, nose, and throat specialist remove wax or look at other physical barriers they may be having to hearing. They're very correctable things. For our vision program, there are a number, and it can be as much as 10% in a year, that are identified as having a vision concern, and they're referred on for glasses or for care from an optometrist. And then thankfully our infant mortality rates and disparities continue to trend downward. And that's one of the things that I think that this board and this community should be most proud of, is that 20 years ago we had very high infant mortality rates, some of the highest in the state. But because of the programming that this county has put in place, along with the great work of our hospitals and law enforcement and others who focused on everything from safe sleep to proper car seat use and everything, fire alarms and everything else in between, we have driven that infant mortality rate down significantly. And we've seen the disparity between white and black babies come down significantly as well. I want to share a little information on a few priorities that I know you have. One is lead. And we often talk about lead in the worst way, and we recognize that it is a significant threat to our community. But also we should recognize that it's a pretty big public health victory area as well, and that we're making huge progress against the occurrence of elevated blood lead levels here in Michigan and in Kent County. The top line that you see here is the city of Grand Rapids. This is the percentage of kids tested every year who have an elevated blood lead level. You'll see that it's high, but it's coming down. The next one down is Kent County. The next below that is Michigan. And then the one on the bottom, the blue, is Kent County if you subtract the city of Grand Rapids. And you'll see that we had this spike back in 2015 and 2016. Many people think that that's because of housing at the time, and we had a lot of housing that had been poor quality being reoccupied for the first time as we were coming out of the recession. But since then, and I would also acknowledge that there is also alignment here with this board and the lead task force. And the work that Commissioner Saalfeld put in place back in 2016, pulling together community leaders to identify some areas that we can work on, including better education, more inspections, more universal testing of kids, and other things that have driven down the rate of elevated blood lead here. We still have some work to do, and we're doing work right now to identify what are some low-hanging fruit that we could work on as a community to continue to press this down, but we are making progress. The next is overdose deaths here in Kent County. And there's a lot of data here. I won't go through all of it. I know I'm over time now. But you will see that last year we had 108 deaths of Kent County residents due to overdose. 89 of those were because of opioids. 50 of them involved multiple substances. And then when you dive down beneath that, you will see that fentanyl was the number one substance that was indicated with 91% of those overdose cases. Cocaine was a distant second. And that combination of cocaine and fentanyl is one that we're seeing quite frequently with these deaths. And this is part of our opioid task force report, and I'm happy to share that with you if you have more interest in that data. Here are our trend lines over the past 12 years. You'll see that from 2010 through 2017, like the rest of the nation, we had a steady increase in the number and in the rate of deaths related to opioids. Since that time, that also coincides with our creation of our Kent County Opioid Task Force. We've seen that level off, and we still have a lot of work to do in this area, but we're thankful at least that we're not still seeing the same increases that much of the rest of the country is seeing. And I think there's lots of attribution here to lots of organizations, including the Sheriff's Department, who put in place their treatment programs for those who are incarcerated. We had greater naloxone distribution in partnership with the Red Project and other organizations in the community. There's been a lot done. Trainings for first responders, equipping first responders with naloxone, education in schools and elsewhere. Lots that have been done in this area. And again, that task force report is available to you. I'd be happy to share it with you. We have two groups that are working hard right now on opioids. One is that task force, which includes people from healthcare, from law enforcement, from pharmacies, from a variety of different sectors of life here in Kent County. And then our Kent County Overdose Fatality Review Team. And this is a group, again, multidisciplinary, who are doing a social autopsy of each one of these, not each one, but a select number of these overdoses, trying to find out what were the upstream risk factors that were happening and how could we have been involved as a community in ways that might have been preventative of that particular death. Our county health rankings. Every year, the Robert Wood Johnson Foundation and the University of Wisconsin release county health rankings of every county in the state, or in the country actually. Here in Michigan, of course, I have 83 counties. Kent County ranked 17th, which may not sound like something to celebrate, but actually there's only one county larger than us in population ahead of us in the rankings. Most of the counties ahead of us are very small. They tend to be higher in socioeconomic status across the community. We do rank in the highest quartile in both health outcomes, which is lifespan and the occurrence of illness. We're doing very well in that measure. We're also doing very well. We're in the top quartile of counties in health factors. Things like access to nutrition and green spaces and parks and in community design. So we're doing well there. We want to do, of course, better. And it gives us something to shoot at and gives us some data to focus in on. And again, I can share this report with you also. Lots of information contained in that county health rankings report. So some significant accomplishments from last year, and hopefully there'll be a time where we don't even bring up COVID anymore. No one would like that more than me. But I do think that we should, as a community, recognize that we're still seeing about 1 death per day here in Kent County residents because of COVID. And altogether, we have lost 1,603 people as of June 6th due to COVID. However, that's much less than a community of our size in general would have expected to see. Our mortality rate, which is a measure of how many per 100,000 of population, is at 239. That's significantly less than the rest of the state, which is 401, and the U.S. overall, which is 341. And you'll see over the course, that line graph at the bottom, over the course of the past year now, we've avoided any significant surges in death due to COVID. So collectively, our county has a lot to be thankful for there, I believe. We had our Crisis Stabilization Center wall breaking, which is, again, another thing that was a collaboration that we, along with many others, were involved with, recognizing that access to health care and mental health in particular was a dire need in the community. That the team at the health department, at Network 180, at the administrator's office, and others had a role in helping to organize and convene this work. Here we've got a photo from the wall breaking, including Mike Janino, who's been co-chair of that convening now for 4 or 5 years and has done great work in moving the ball forward. Bill Ward from Network 180, Senator Rick Outman, along with his grandson Miles, Al, myself, and Dr. Matt Biersack, the president of Trinity Health St. Mary's, all part of the team there. And not included in this picture, but who definitely deserves some recognition for this, is Chair Stuck also. Chair Stuck has truly been a champion for this cause and has been persistent in his focus on seeing this happen, and so we're very thankful for his leadership as well. Lots more data that I won't go into in great detail, but every month we publish a notifiable disease report. Again, happy to share this with all of you. The physicians and healthcare providers in Kent County and really across the state are required to notify their local health department whenever there is the occurrence of a notifiable disease, one of about 80 different illnesses that are required to report on. We receive those reports within 24 hours of diagnosis, and if it's something where we can intervene through our investigation to try to stymie an outbreak before something bigger happens, we do that. Here you're seeing some of the numbers that are contained in that report. For example, and this is the December report. So it includes the number reported for that month, the cumulative for all of 2022, which at the end of December was the entirety of the year, and the median cumulative for the 5 prior years. So you're seeing basically a representation of what approximately we should expect to see. Things like AIDS. So last year we identified 9 AIDS cases, full-blown AIDS. So it's a good reminder that that's still a threat in the community. But very much in line with what we would expect, because normally we see about 10. Going down that list, I want to point to Shiga toxin producing E. coli. Last year we identified 45 cases of Shiga toxin producing E. coli, where normally we see about 20. So about 2 times as many as we would normally expect to see. That was due to an outbreak associated with lettuce and some other produce that was distributed across the Midwest region to fast food establishments. And there near the bottom, influenza-like illnesses. We had reported 16,603 last year, where normally we would see close to 40,000. So we're very thankful that once again we had a low influenza year. On the bottom half of that report, you'll see Lyme disease is interesting. 28 cases of Lyme identified last year, where normally we'd see 13. That is in part due to the expansion of the range, the ticks that spread this are living, and the occurrence of the bacteria within the gut of those ticks is becoming more and more common. So that's something that we know that going into this year, we want to work with the community to educate them, along with providers, to let them know that this is growing in prevalence so that they can look for it and can treat it in a timely manner. And then down at the bottom, West Nile virus. 0 cases last year. Yay. You know, as someone who's worked with West Nile virus for its entire time here, going back to 2002, 2003, where we had many deaths because it was a novel virus that people were first being exposed to with no prior immunity, to see that now we had no diagnosed cases. Now, certainly we had cases, but they weren't ill enough to go see their doctor and get diagnosed, which that's winning for us because it's not going to go away, but if people aren't getting severely sick, that's a win. Looking ahead, we want to do more to stay ahead of lead. So we talked about a little bit how we have lead. I think we're pushing it closer and closer to the ropes. Now we're looking for low-hanging fruit. What else can we be doing? One of those things is relative to water. And while here in Kent County, the major source of exposure is paint and dust and those physical points of exposure, water generally is not a major point of exposure, except that it can be in homes where they still have lead service lines or they have lead fixtures in the home. So we're looking at ways that we can more effectively target those individuals, especially those that have kids in the home, and try to raise the level of information they have and maybe the resources they have to protect their families from that kind of lead exposure. Our Food Safety Excellence Initiative, I call it our Project Fly Swatter, is something we put in place prior to the pandemic. And it's working with the industry and the community to make Kent County, and this is really important to me, I want Kent County to be known as a community of food safety excellence. I think that's really important to everything we're trying to do here. And it's something that the industry is really excited about as well. There's a national award for this, the Crumbine Award. I really want Kent County to be a recipient of the Crumbine Award in the near future. Our Refugee Health Center is a project that we've been working on, especially with the increases in refugees who are coming here from many places around the world. They have language issues, they have diversity of culture, and so many things that make them a bit complicated to navigate into a healthcare provider's office to begin with. So we're working with the healthcare providers in this community to identify how can we more effectively create a ground zero for refugee health that helps to get them in, get them the care they need, and then hopefully integrate them into care providers throughout the community. And then our community health needs assessment. And that's something we do every 3 years. We do it in partnership with the 5 nonprofit healthcare systems here in Kent County. They're required by law to do this. It's an assessment of the needs of the community, looking at data, looking at surveying the community, finding out what's important to the people who live here, and then working with them and with those partners to create a community health improvement plan where those healthcare partners can actually focus some of their community benefits dollars towards making improvements on those priorities that the community have. You'll see that back in 2020, access to health care and mental health were among the priorities identified by the community. That's one of the reasons why we worked so hard for that crisis stabilization unit. Okay, so I'm way over time. My apologies. I did my best to squeeze it all into one day, but thank you all. I do appreciate the support and a team. You have a tremendous team at the health department that truly love this community and love making a difference. So, honored to represent them. Thank you.
All right. I know there's going to be a few questions here, so commissioners. Commissioner Pakla.
Mr. Chair, and thank you for that presentation, Mr. London. You know, the thing that I always remark on public health is that it's really so very data-driven, and it's great to see that we have so much great data both at your fingertips and at our fingertips as a community. The question I had for you is thinking about public health really as requiring that concerted effort amongst all the stakeholders, and you mentioned the great team that's within the public health department. I'm wondering if you could give just a brief couple sentences or a few sentences about the collaboration that happens both cross-divisional within Kent County and cross-organizational. We've seen some of the partners that you have in various efforts, but I'm thinking in particular about the community information and engagement aspects of the work that you do.
Yeah, so I think that it's all part of what we call Public Health 3.0. We're getting away from the programmatic, we deliver a service and we write permits or we do immunizations. Those are all important parts of what we do. But the reality is many things that we're working on today, things like substance use and lead and obesity and cancer. Some of the things that are really cause drivers of morbidity and mortality today are far beyond the ability of the people in our walls to change. And so working with partners in the community and working with other departments within the county has been increasingly important to the work that we do. So everything that I've said here, and especially to get those significant accomplishments, very few of them are things that we did. We did them as a partnership with the community, with law enforcement, with the educators in the community, with nonprofit associations, with faith-based organizations. It's got to be an all-hands-on-deck approach, or we're not going to make much progress against some of these more challenging threats that we have.
Commissioner Hennessy.
Going back to the beginning of your report on septic systems, how do the septic systems inspections, reviews, how do they come to you? Are they like through the point of sale inspection, or are they the failure and wanting to, redo the system? How do these cases come to you? I know statewide, there's more move than there has been in the past to try and create a statewide septic system series of legislations. But, but I'm curious as to how your department receives them.
Yeah, it's a good question. We receive requests for evaluations at the time of real estate transfer for about 400 transfers a year. We then go on site. We often require the tank to be pumped if it hasn't been in a while. We do a physical inspection of that system to determine whether or not it's functioning properly and is significantly compliant with code requirements. Most of the remaining transactions do involve an inspection from a third-party inspector. And so there is often someone that will come out and do an inspection of some type of that system. We don't review those. In the state of Michigan, it's not required for us to receive those reports unless there's a failure. If there is a failure, then we're required to go on site to do an evaluation and to issue a replacement permit for that. The majority of the 1,000 or so permits that we get a year are for new construction. A lesser number of those, probably less than half, are for repairs where there has been. With that, going back to the real estate program, we generally find about 10% to 20%, and I'm just speaking roughly here, don't quote me please on that, but that are in a state of failure, where there is a replacement that's needed.
Thank you.
Commissioner Baker.
Yeah, in a way, my questions were answered in previous, and so these maybe will be more of a comment. But when I looked at the data last night, especially like say for lead exposure, I saw the testing, and the testing is a metric of where we're at, but it's not the solution. And I'm gathering that your responsibility isn't testing; it's to work with housing and other entities that are responsible for the environment that children are in. So anyway, that's my question. I think the collaboration question that Chris asked. But anyway, could you talk just a little bit about that collaboration and how the health department works rather than just measuring or doing what we would typically think of happens in a health department?
Sure, and actually, I believe we are the #1 tester as well,
Okay.
because the WIC program has a requirement for testing. And so I think the majority of tests conducted in Kent County are through our WIC program. And that's something that we have been working to change, because we really want providers, pediatricians everywhere to be asking questions such as, what's the age of the home you're living in? Do you have lead fixtures? To see there are risk factors that should be prompting a test here. So we want to see that happen. We also know that as that happens, we're going to get more kids tested. We already are. That's going to drive down the percentage of kids that have an EBL, because we'll get lower risk kids tested. So we need to make sure that we don't think that that's a victory when actually it's telling a different story.
Right.
That's a concern we have. But we know that we need to be doing more to help make that home environment as safe as possible. And that's really equipping parents with resources. One of those is the availability of contractors who are certified to do that work. So we are working through our lead action team, which includes folks from industry, education elsewhere to try to find venues for providing that certified training, so we can get more people in the workforce that can do that work.
Okay, thanks.
Commissioner LeGrand.
Thank you, Chair. Well, forcing you to do it all at once certainly forces us to understand the incredible breadth of the operations of the Health Department. Just a couple things kind of that relate to immunizations, tuberculosis, that are we finding that the people with it have, I know that there are some other countries where there's more, or maybe it's a strain that's resistant to the immunizations that we typically get, but where's the tuberculosis coming from that we're seeing?
Yeah, so there's not a vaccination for tuberculosis. The majority of the individuals are coming through that refugee program. So they are coming from other parts of the world where they have a lower prevalence of tuberculosis to begin with, or they have a higher prevalence than we have here to begin with. So it's important for us to catch that, but again, they're latent. So they have the infection, but they're not sick in any way. We also do pick up quite a few that are sent to us for screenings for new employment. Especially in the healthcare fields, it's often required. You have to go get a TB skin test, and we do that, and sometimes surprised, you've got TB. So that's something where we can identify it. And we have, again, seen some weird manifestations of that infection developing in other parts of the body, the eye, the spine. There have been some strange ones in the past few years that it is important to identify if you do have that latent infection and to get treatment if you.
For some reason, I thought that weird thing, the weird scar on your arm was a TB thing.
Smallpox.
Smallpox,
yeah.
okay.
Yeah.
Well, that
An
explains
even bigger
it.
monster.
And then my other question I think if there was another disease that was killing someone in Kent County every day, we'd all be freaking out. But compared to what it was, we're glad that COVID is kind of resolving. But I'm wondering, are we still operating vaccine clinics? I know they're going to be trying to do boosters and that sort of thing. Or are people just kind of on their own now, go to your drugstore, that sort of thing?
So a little bit of both. So
Okay.
we have rolled the COVID vaccine in with the rest of our vaccine schedule. It's there,
Okay.
it's available. We're not running any COVID-specific
Yeah.
clinics. I think one of the big wins of the past 4 or 5 years, even before then, we were working on what we called a push strategy. That when something bad happened like it did, that we wouldn't be the only place that people could go to get vaccination or whatever sort of medical intervention was recommended. But that we could have a network of places like pharmacies that could quickly mobilize and could do that so that there's a place within an easy access of all people and that you wouldn't have to drive to one giant center to make that happen. So I think that's been a win. Certainly we've seen more and more providers that are able to handle vaccine, which isn't really easy. Some of them are kind of tricky with the temperature and holding requirements that they have. But we also work as a hub for some of those, and we can distribute as well. So long story short, there's a lot of organization that's happened and has been improved because of the experience of the past 3 years.
Oh, that's great. That is a big win, and it does seem easy to get, so that's wonderful. Thank you.
Commissioner Hennessy.
You talked about the Food Safety Excellence Program, and how do you acknowledge those food establishments that have really good inspection ratings?
Yeah, so I want to get back to that. I think we were doing a really good job of that before the pandemic, where we had a certification program and an award for those that had gone a certain period of time without a priority violation and who had trained their staff. And we had a series of targets they had to hit, that if they were doing these things, we wouldn't punish them, like so many feel like they get, the regular program is punitive in so many ways, but we would celebrate excellence and publicize it. And we want to get back to that, where we're publicizing excellence and sharing that so that it's a real draw and encouragement for others to want to shoot for that standard as well.
I'll still walk in restaurants and we'll see certificates framed from, but they tend to be old. And so
Yeah,
I do
they're very proud of them, which
Yes.
I'm thankful for. But if you look at the date, they're often from like 2017 or 18 or yeah.
Just tell us where to go and not to go. So just, that would be.
My philosophy on that is if it's a place that's open in Kent County, I'll go there.
All right.
And if it's a place that I'm not comfortable going, then I'm going to be doing something about it. And you won't have to worry about it
Well, that's
as
great.
much.
It is available online, is it not?
And our inspection reports are available
Just
also.
going to Access Kent and then to the Health Department and then looking through
The
there?
links, yep. Mhm.
Okay, thank you.
Thank you, Commissioner Hennessy. Anyone else? I just have a few items. At least you do not have the title dog catcher anymore.
Thank you.
So we saved a few minutes there from your presentation. Just one stat that I thought was interesting, I guess that I picked up on. 78% of children 24 to 36 months are fully immunized. What do you believe is I know it's probably a guesstimate, the percentage of, all right, I just don't believe in immunizations, my kid's not going to get it, versus maybe there's just not enough education?
Oh, boy. How much time do we want here? I think we're pretty close to that, honestly. I think that the remaining 20% or so are people that, they have different beliefs about the vaccine. They have a different understanding of the information, and they've come to a different conclusion about what they want for themselves and their family. And so, we're not in a position where we would want to or can, beat them up about that. It's not going to help anything. So we're here. They know where to find us. We'll continue to provide information, and they can continue to make informed decisions about what they want to do for their families. And that's really, all we can do. So.
Awesome. And again, just keep on encouraging on the well and septic permits. Obviously, that turnaround's decent. Sometimes it's a little slow on my end, but then again, it's because I want it within 3 days, not 2 weeks, right? So again, keep on encouraging that as well. Health Department's an excellent source for that on any real estate transaction. And again, I appreciate your staff. I was out there with one of your employees the other day, and of course, just kind of asking about all sorts of different. I just wanted to learn, right? So what about this? What about that? So very, very educational for me, and I learned a lot. So
Thank you.
Adam, again, I appreciate it. I know you had a presentation that we probably tried to pin you down a little bit more on, but we really do appreciate your time today and the work that your staff does to keep Kent County healthy.
Thank
So,
you. And
thank
again, if there's any additional information or if you would like to see those reports, I'm happy to share them.
All right, thank you so much. All right, in my midst of trying to get things going and trying to get this done as fast as we can, I forgot to have the last meeting's minutes approved. So I do need a motion for last meeting's minutes to be approved by Teal, since she's the one that mentioned it to me. Support by LeGrand. So motion by Teal, support by LeGrand. All those in favor say aye. Aye. All those opposed? Last meeting's minutes have been approved. Commissioner miscellaneous. Is there any Commissioner miscellaneous? All right, seeing none, meeting's adjourned.